Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will study a topic which will be asked as a very short kind of question. Okay, so you have to read this topic from that perspective, and the topic is lesions of upper respiratory tract. So let's study. What are the things you have in your upper respiratory tract? You have nose, paranasal sinus, nasopharynx, oropharynx and larynx. Okay, these are the things that are there in your upper respiratory tract. Now what happens if there is lesions? There will be inflammatory lesions, there can be infectious lesions, allergic or traumatic lesions can be there. So let's talk about the lesions of nasals and paranasal sinuses. So you have first thing called as the rhinitis. In rhinitis, you have the first is the acute rhinitis, and acute rhinitis is related to your common cold. What are the causes? Causes are mainly the viral causes. What is the pathology? You have the mucosal edema. Then there can be hyperemia and the catarrhal discharge. Next that you have is the allergic rhinitis. Allergic rhinitis is also called as the hay fever. It is related to your type 1 hypersensitivity, because I have already told you if they are talking about allergy E, it is related to IgE mediated. E is related to type 1 hypersensitivity. They are triggered by the pollen, they are triggered by the dust and the animal danders. Features will be, there will be excessive amount of sneezing, nasal congestion, the patient will not be able to breathe that much. Then there will be watery discharge, water will be coming out from the noses. There will be eosinophil rich infiltrates that will be there. Next you have is the nasal polyp. Okay, so they are the benign mucosal protrusion due to the chronic rhinitis. If the patient is suffering from the chronic rhinitis, he is more prone to developing the polyps. The polyps are mainly soft, glistening, and there is translucent mass mainly. Like if I draw your, why I am drawing the lungs again and again, I don't know why. These are your nostrils, although they are not your nostrils. Let's suppose these are your nostrils. So inside your nostrils, somewhere here, you will be having a polyp. Okay, it will be like a protrusion like this. It will be very red. It will be shiny in color, okay, and it will be globular. In microscopy, you will be able to see edematous, stroma and chronic inflammatory cells. There will be nasal obstruction, because if there is polyp, how the person will be able to breathe, right? There will be recurrent sinus infection. Let's talk about the sinusitis also. Sinusitis is the inflammation of paranasal sinus. What are the causes? The causes is obstruction of ostia that will cause polyp and deviated nasal septum. You know what is deviated nasal septum? Like, wait, I think we have to draw a very beautiful nose now. Okay, these are your nostrils. Let's suppose these are your nostrils. So, you have a bone in between, you have this bone in between. So, what happens is, if instead of growing straight, in some people it is deviated. Instead of going straight, in some people it is deviated either towards the right or either towards the left. So that is called as the deviated nasal septum. There can be infections like the streptococci, staphylococci and the anaerobes. What are the types? You will be having the acute one. Then you will be having the chronic one. In the acute one, there will be painful, purulent nasal discharge. In the chronic one, you will be having a long history of mucopurulent discharge. What are the complications? The complications will be orbital cellulitis. It is a kind of infection that will occur. There will be meningitis that will happen in your brain, and there will be brain abscess. Next that you have is the infective lesions. In that you have the rhinoscleroma that is caused by the Klebsiella. Then you have the chronic granulomatous disease. that in the microscopy you will be able to see the M cells, which leads to what? Which leads to the nasal obstruction. Then you have something called as the rhinosporidiosis. In the rhinosporidiosis, there will be a mass which is friable and it bleeds easily. If there is any trauma that will occur, the mass will bleed easily. It's similar to the polyp, but it will bleed very easily. What is the diagnostic approach that you should follow? The diagnostic approach is you have to take a proper history and do the physical examination of the patient. See for the symptoms, onset, duration, and aggravating and relieving factor. These are the main things that you have to take in the consideration while taking the history of the patient, right? Then you have to do the endoscopy. In endoscopy, the nasal endoscopy and the laryngoscopy. In the imaging, you have to go for the CT and MRI. In the biopsy, you will be able to see if there is any suspicion of the mass is there or not. This is your summary table. What are the things that we have discussed? That nasal polyp is bilateral, allergies will be there, and pale and edematous. There will be unilateral nasal obstruction in adults, which is always suspect. If it is always there, then suspect the tumors. If there is hoarseness of voice that is more than or equal to 2 weeks, there is laryngeal carcinoma. Okay, and if there is an association of Epstein-Barr virus, then think of nasopharyngeal carcinoma. See, this topic is not that much important. Read this topic from the perspective of that it will be asked as a very short kind of question. Okay, we are done with this chapter. If you are having any sort of doubt, please feel free to reach me. Please feel free to DM me. Thank you so much.